Hi everyone, I'm Katharina King, Mission Programs Manager at Komen North Texas. Welcome back to our monthly educational series. If you missed any of our previous episodes, be sure to check it out either on our Facebook page or our YouTube channel. Just search for Komen North Texas. Today we are excited to talk about our grants program and the organizations who are receiving funding from Komen North Texas this 2019 grant cycle. They will provide the free mammograms, diagnostic services, and breast cancer treatment to the men and women in our North Texas community who have little or no insurance. Before we introduce those organizations, we want to explain how the Komen North Texas grant program works. For step one of the grants process, we develop a community profile report that outlines the state of breast health in our 13-county service area. We pull information from the National Cancer Registry, the U.S. Census, health providers, and from focus groups with community members during our research process. The community profile tells us important statistics such as who is or isn't getting mammograms, how many people currently have breast cancer, and what challenges people have in accessing breast services. From this report, we create a mission action plan that identifies priority areas and targeted populations so we can ensure the programs we invest in are doing the most good for the most people. This year, the mission action plan outlines 3 priority areas. First, we want to fund projects that provide patient navigation for people who reside in the 13-county service area. As a refresher, patient navigation are services that help patients understand their breast health status as they move through the healthcare system, such as knowing the difference between needing an ultrasound versus an MRI, or if they need radiation instead of chemotherapy. Patients are navigated or assisted through the next steps to ensure they receive the most complete breast health care possible. Next, we want to fund projects that provide quality and timely breast health care to people in our community who need it, whether they are insured or uninsured. This includes projects that provide free or low-cost screening, diagnostic and treatment services, mobile mammography, transportation, interpreter services, or medical treatment. Finally, we want to fund projects that provide culturally relevant breast cancer education in one-on-one and group settings while providing direct breast health patient services. Once we have these funding priorities, we list them in our Requests for Applications, or RFA, and provide guidelines on how to apply for a community grant. All nonprofit organizations who are providing breast health services to women and men in our service area and who address one or more of our priority areas are encouraged to apply. After applications are submitted, an independent review panel of community members reviews each grant application. This means that it is not Komen staff or board of directors who are determining the grantees. It's our community members. This enables us to have a fair and unbiased selection process. The independent review panel ranks and scores each application, which helps them determine which programs will receive Komen North Texas funding. Organizations receive funding for 1 year, spanning from April 1st through March 31st from Komen North Texas, and are not guaranteed funding from year to year. On April 1st, we announce the organizations receiving funding for the year and begin to refer the women and men who contact us seeking breast health services to their programs. The final piece of our grants process is monitoring and reporting. Throughout the year, we monitor the program's progress to ensure that the community partners are using their grant money as outlined by their applications. We reserve the right to rescind funds that are not being used properly. This is to ensure that our donors can be confident that every dollar they give us is being used appropriately in our effort to end breast cancer forever. This year, we are excited to announce the following programs are part of the 2019 Community Grants class. Asian Breast Health Outreach Project, Bridge Breast Network, Moncrief Cancer Institute, North Central Texas Community Health Care Center, Texas Health Resources Foundation. Let me tell you a little bit about each of these organizations. AdHoc provides understandable, culturally appropriate breast health education and access to preventative breast care services for the at-risk individuals in our communities. With linguistic, knowledge, cultural, and/or financial barriers, it's hard for minority populations to access care. AdHoc staff speaks multiple Asian languages to bring breast health awareness, scheduling ability, registration assistance, on-site education, and systematic follow-up of exams until diagnosis is reached at the Women's Imaging Center at Methodist Richardson Medical Center. The project will serve and empower all ethnic groups to enter and stay in the breast cancer continuum of care so that no one is left behind. The Bridge Breast Network provides breast health education, patient navigation, and access to care to low-income, uninsured, and underinsured individuals. The program will provide breast health education, patient navigation, and access to mammography services and breast cancer treatment and survivorship services to North Texas residents. Moncrief Cancer Institute provides breast screening and patient navigation for medically underserved women across Komen North Texas's 13-county service area. The program offers low to no cost screening mammograms, diagnostic services, patient navigation, and surgical treatment to underserved women across the service area. North Central Texas Community Healthcare Center provides access to high-quality screening and diagnostic services to low-income, uninsured, and underinsured women in our community by targeting women between 40 and 65 years of age and reside in the counties of Archer, Baylor, Clay, Montague, Wichita, Wilbarger, and Wise counties. The program will provide mammograms, ultrasounds, sonograms, biopsies, surgical consults, and other services as needed. Texas Health Resources Foundation, through a collaboration between Texas Health Presbyterian Hospital Plano and Texas Health Wellness for Life mobile health program, will provide screening mammograms to low-income, underinsured, uninsured, and culturally and/or geographically isolated women in Collin and Wise counties, as well as follow-up diagnostic services through biopsy through its early detection and individualized treatment, or EDIT, program. The project will direct specific educational outreach to African American communities in the service area, as well as women living in Wise County. For more information on the grants program, you can visit our website, KomenNorthTexas.org. So now that you know how the grants program works, here's how you can use the Komen North Texas Community Grants Program to receive breast health services. First, start by giving us a call at 972-378-4808 if you or a loved one needs a mammogram or other breast health service, or if you just have a breast health or breast cancer question. Calling our office is the best place to start. We can get you connected to the resources you need. If you're wanting access to breast health services, the first thing we'll ask you is what county you live in. We need this information because some of the grantees provide services in specific counties in North Texas, and we want to get you to the right provider. By the way, if you happen to mention a county that is not within our 13-county service area, we will connect you with another affiliate that does cover that county, or we will provide you with a secondary list of resources. Once we determine your county of residence, we provide you with the contact info for grantees who are able to provide the service you need. You give them a call, they'll ask a few screening questions, and then you'll be scheduled for an appointment. That's it. It's that easy. Unfortunately, there are times when grantees have limited funding and aren't able to get you scheduled quickly. Please give us a call and we can help identify other providers through our Komen helpline or other community partners. We are always available to help you navigate this often confusing process, so don't hesitate to contact us and we'll try our best to explore available options. Just to clarify, Komen North Texas is not a direct service provider, which means we don't see patients in our office for exams, we don't have a mammography machine, and we don't make calls to schedule medical appointments. However, through events like Race for the Cure, we are able to fundraise and channel those funds through a fair and strategic grants process focused on making the biggest impact in North Texas breast health. So when you fundraise for Komen North Texas, you can rest assured that you're supporting your local community, your friends and neighbors, the people you go to school or work with, or see at church and bump into at the grocery store. Additionally, you are also helping cancer researchers with their groundbreaking work to end breast cancer, because part of what Komen North Texas raises is invested in the National Research Grants Program. For our Komen Scholar Spotlight this month, we want to introduce you to a researcher who benefited from your fundraising efforts and donations by receiving a Komen Research Grant. Sharon Giordano, MD, MPH, is chair of the Department of Health Services Research and a professor of medicine in the Department of Breast Medical Oncology at the University of Texas MD Anderson Cancer Center. A health services researcher and clinician, Dr. Giordano's research focuses on evaluating how a variety of factors like social, financial, personal behaviors affect access to and quality of health care, and ultimately how this impacts health outcomes for cancer patients. She has also led a series of studies on male breast cancer, including a Komen-funded international clinical trial to better characterize the clinical features, biology, and outcomes for men diagnosed with breast cancer. We had the privilege of having Dr. Giordano serve as the inaugural Komen Scholar presenter at the Komen North Texas Scholar Series Breakfast in March 2018. It was at the event where she discussed her Komen-funded research about financial toxicity, or the negative psychological and financial effects of breast cancer treatment. This phenomenon can occur when a physician treating a breast cancer patient isn't aware of the financial impact of the medical treatment on the patient, or when financial concerns affecting a patient's decision-making for their medical care. For example, a physician may prescribe a specific chemotherapy drug best suited for the patient's breast cancer treatment, not realizing that the drug might cost $10,000 per infusion. The patient, especially if they're uninsured, may not be willing to put their family at financial risk and may forego treatment. If the doctor and patient had spoken about financial limitations at the start of treatment, they may have been able to explore other less financially burdensome options. By having these conversations at the outset, the doctor and patient can decrease the likelihood of the patient having to forego or delay treatment for financial reasons. Through her research, Dr. Giordano explored both the emotional and financial stress of a breast cancer diagnosis in the hopes of better understanding all the issues facing a breast cancer patient and to develop strategies so Komen can have a positive impact on all issues facing a breast cancer patient. From her findings, it is clear the need for financial transparency in cancer treatment is an important research area and will benefit breast cancer and all cancer patients in the future. Thank you, Dr. Giordano, for her work. And if you'd like to learn more about the Komen Scholars, you can visit komen.org/scholars. Just one more reminder before we sign off for today. Registration is open for our North Texas Race for the Cure. The Race for the Cure will be on Saturday, May 18th at the Star in Frisco. Register today and find more information at KomenNorthTexas.org. Thanks for tuning in, and we'll see you next month.